Why is a total knee replacement so painful? Well, a lot of patients do not want to watch the procedure on YouTube before surgery, and I certainly don't blame you. But it's important at least that you have some understanding of what's going on. So we believe the reason the procedure is so painful is because there is a tremendous amount of trauma that happens to the tissue. The ends of the bone is cut off, the skin is cut, the muscles, the tendons, the blood vessels, the nerve endings, everything is pulled to the side, everything is disrupted. There's tissue damage associated with the surgery. And then of course afterward, everything is sewed back together. There's significant swelling, there's significant residual pain. It's a challenging procedure. I wouldn't want somebody to go into a total knee replacement thinking that it's going to be a breeze, that they're not going to feel anything, it's no worse than a toothache. It absolutely is a challenging procedure, and it has major physical demands on your body, psychological demands on your spirit and your soul. So I want you to be as well prepared as you possibly can, but keep in mind, everybody who's helping you has helped other people before you. And we will do everything in our power to make this the most comfortable, pleasurable experience that we possibly can.